Go live. So our meeting is streaming live on Facebook. Hi, Melissa.
Hi, Renee.
How are you today?
I'm doing really good. How are you?
I'm great. It's spring. It's Friday. It's all a win-win.
Yes.
Well, we're here on Facebook from Zoom with our health tips series. And as everyone out there on Facebook and Instagram, on YouTube knows, we do this series every Friday. This Friday, we're talking about our ways to manage stress and self-care, especially in the time of COVID. But the tips we're going to share today are really for any time in our life, right, Melissa?
Yes, very much. For any time in our life and for anybody at any journey and any point in their life.
Yeah. So I'm so excited to be here with you. And I want to, before we jump in, I want to say a big thank you to our sponsor for this series. It's Yakima Federal Savings and Loan. They sponsor all of our health tips series. We're so grateful to them. So if you're watching, drop a comment and, say hello to Melissa and I and give a shout out to our sponsor. Without them, we couldn't do this work. And all of the sponsorship and donations that go towards programs like Health Tips benefit our Healthy Yakima initiative. So these are programs that help keep our community sustaining a healthy and vibrant work for our lives. So we're grateful for that. And Melissa, you work in the palliative care setting as a social worker.
Yes, that is correct. I've been working here for about 2 years now as the licensed clinical social worker here in palliative care.
That's great. So I was checking out your bio before we started, and your bio is fascinating and amazing and inspiring. You were in the Navy, then you got your master's degree in social work, and you've been with Memorial for 5 years, and you were able, as I understand, like clinical social work was your passion. Tell me about that.
Yes. So clinical social work is really just another step, really a state exam away from MSW, a master's level social worker. And I came into Memorial as a MSW over at North Star, where I pursued getting my hours, my training, and taking that state exam to be a clinical social worker and really focus on mental health, anxiety, depression, trauma, and in the medical field, really the crisis management of some of those pretty difficult diagnoses that we deal with on a daily basis.
Wow. What that is powerful work, and it must just really fill you up every day to be a part of a community like that.
It really does. And especially in palliative care, where we reach some of the most difficult population to serve, whether it's due to transportation, health, or insurance difficulties, we are able to really target people who otherwise wouldn't have mental health services.
Can you explain for us a little bit, just for those folks who might not know, can you kind of explain what the idea of palliative care is? Because I think sometimes we were having conversations about this earlier in the week. Sometimes people have a big misunderstanding of what palliative versus hospice, those kinds of things are.
Yeah, and it can be pretty confusing. And most people know what hospice is. And a lot of people assume that palliative care is kind of like a pre-hospice, but that's not necessarily the case. We really work with people who have chronic life-limiting illnesses or acute, like a stage 1, stage 2 cancer that is curable, but still very life-changing. And so we work with the patients and the families to help them process the diagnosis, the difficulties emotionally with that, also getting resources to the community for caregiving services and connecting them and providing almost a coordination of care service to ensure that they're getting the care that they want and meeting the life goals and quality of life that they're setting for themselves. And with some of those diagnoses, the transition to hospice is likely, and we just try to make that as smooth a transition for those patients as possible.
So one of the things that I think we've been talking about, you and I have been talking about, is this idea of those folks who do have those life-changing or life-limiting situations. Isolation has become this driving force in their life or this driving presence in their life. And there's been an increased need. Well, the need has always been there, right? For that social support. What does that look like now, or what does it look like in general in our community?
So in general, typically when families have strong family support within the community, before COVID, people could rely on them for caregiving services, and they had a little bit more support. Post COVID, it's even more difficult. That we're limited on caregivers who are available, even paid caregivers. Our patients are typically very much at risk if they get COVID, that it could have some very negative, if not deadly consequences. And so their isolation is increased tenfold because they cannot risk getting COVID. So they even isolate from family members who normally would be a support. So you have a very difficult diagnosis, and then you have this added forced isolation due to the pandemic and no support to help manage through this time of need that you have. And so that puts a lot of the, I don't want to say the burden, but it does put our social workers out in the field more, having to fill in the gaps of where family members normally would, for some of that emotional support.
Wow. So I mean, because I'm imagining that pre-COVID, you and your team were already very busy.
Mm-hmm.
And
Yes.
so it sounds like now that need for your support has increased exponentially, almost overnight.
Yeah.
And what does that look like? Like, are you going into people's homes? What does the support service look like?
So specifically for palliative care, we have 3 options. So I can do home visits. We do have a clinic that I can see them here as well. And then we also have Zoom for patients who are very high risk of negative consequences to COVID and just do not want to leave their home. So we have those 3 options. Back last year, it was really Zoom was it, and it wasn't working to the best that it could when people are already isolating, and you're looking at increased depression, increased suicidal ideation, increased family crisis because families worried. Getting those home visits started safely again was one of the biggest important factors that we had, because patients really did do much better once we had home visits started. So, but it did take some time.
Yeah. And I can imagine how hard it would be for me to help someone through that, especially when you can't go and you're trying to help them through Zoom, maybe a technology they're not familiar with. Talk a little bit about the high risk of burnout that social workers have. I don't know if that's in general necessarily, but especially right now.
Yes. And I would say in general, social work is a very high burnout field. You go into this because you love to give to others. Sometimes you have a difficult time taking care of yourself and setting those boundaries to know when you need to focus on your own health. And with COVID, you feel that need from the community even more, and you want to fill that gap. So your caseloads increase as more people are getting sick and have less family support, and you want to be there in neglecting the rest that you need to take for yourself and the moments that you need to refuel for your own energy.
Wow. So it sounds, what you said is in order to help others, we have to take care of ourselves. And that concept seems very simple, and it's something that we can really scale. So let's kind of jump into the the tips portion of today's episode, because these are tips, like you said, that anyone can benefit from.
Yes, and that's very true. It really is, because I'm sure right now and at any time, we social workers are not the only ones experiencing burnout, and the isolation is getting to everybody, especially those who have lost jobs or have been furloughed. So these tips are really for anybody who just needs to take a minute to find some internal peace, a little bit of internal comfort to recharge so you can move forward through your day.
And
So
these are going to be great tips, even as we start to move out of the pandemic, even if that's not tomorrow or next week or next month or next, but as we start to move out, it's going to be easy to think, everything's great, but we're still going to need to be using some of these tips for our own self-care.
yes, correct, especially as we get busier.
Yeah.
So one of the things that I really like to encourage for many different reasons, especially as the weather improves, is to get outside, even if it's just 10 minutes a day, whether you're sitting on the porch or going for a walk. The sun really helps with the vitamin D, which helps with depression. Fresh air, get moving if you can, do that walk, increase those endorphins. And it can also combat some fatigue. So if you are at home or you are burned out and you need just a little energy boost, just going for a 10-minute really brisk walk outside will help in multiple areas of how to improve your mood. So that's my, especially with the weather, that's my number one recommendation for anybody is just get outside for 10 minutes a day.
When your brain starts to feel like it's swimming and you can't quite capture all the things, hit the road for a few minutes.
Yes, yes. Enjoy that sun. Wear sunscreen, but enjoy it. And then the next one too, for those of us who have difficulty making time to get outside or who for any reason can't be out in the weather, or if the weather's just rainy or cold, we really like to focus on mindfulness. So anxiety is often reflective of things that we worry about, the past that we can't fix or what things used to be like, or we're fearful for the future and we don't know what that's going to look like. And while our mind's doing that, we're forgetting to be where we are currently and what it is that we have to appreciate for today. So with COVID, one of the things that has been an improvement is online access and app access to meditation. So I like to encourage a 5-minute meditation during the day, whatever time of day works for you, morning, afternoon, evening, and give yourself time to focus on your breath and focus on being present in the moment and just kind of feel that release of tension go through your body so you can refocus on the next step later.
That's great. That's great. That could be a whole other series of health tips. We could do an entire month just on mindfulness activities.
Yes, yes, you can. And once it becomes routine, you almost, it does, it just becomes habit. Funny story, my habit is to do it at night. And now if I start to meditate during the day, I can doze off really quick. I have to be really careful during the day to do some uplifting meditations and not the really same ones.
Ready for the next task. Let's get going.
Yes, not time to sleep.
Not time to sleep. Great. So we have get outside, move around, get some vitamin D, practice some mindfulness, either with some online meditation, a meditation through an app, or even just kind of sitting and appreciating the present moment. So what's our last tip for today?
So the last tip is physical activity. And you can do this in the house, you can do this outside, but it's really about releasing that tension physically and increasing those endorphins, and just really kind of getting your body moving. Yoga, cardio, walking, riding your bike, anything like that. Just if you can do that for 10 to 30 minutes a couple times a week, you'll get a really big benefit from that.
That's great. And Matt, if you could combine all those things together and have a little triad of self-care every day, that would be really great.
Yeah, it would. And even if it's just one of these a day, or something as simple as taking a warm bath, drinking a cup of tea, and even decreasing the amount of news you watch can have a huge improvement on some of these self-care tips, especially with how our news has been lately.
Yeah, sometimes you just have to know when it's okay to turn the dial off, close Facebook, close the browser.
Yes, yes.
Well, this has been great, and I want to give people who are watching an opportunity, if they're curious about how they can connect with some of the services that you mentioned today, how would they go about doing that?
So there are a couple different ways. I really like to encourage people who have the EAP Employer Assistance Program to contact that program. You can get some, I think, 3 sessions with a licensed counselor or therapist that can really get a good plan of care set for you. That would be the number one recommendation. Also, talk with your family and friends and see what their recommendations are. There's always faith-based organizations or referrals from friends to the community for some professional assistance. And there's a few apps online too, like Calm and Headspace. That would be a good resource as well.
Great. I'm going to jot those down. And when we get done with this live, I'll put them in the comments for everybody watching. The EAP Employee Assistance Program, is that something they could just connect with their organization's HR department or whoever manages their employee benefits?
Yeah, it would be the HR department. Yes.
Great.
Yeah.
Okay. Well, Melissa, anything else that you want to share with folks today?
I think I just want everybody to just know that it's beautiful outside and do the best to take care of yourself. And if you ever have any questions, you can always give us a call at Palliative Care and we can get you pointed in the right direction.
That's great. And we'll put that phone number in the comments also. And so you and I will stay on for just a minute, but we're going to say goodbye to our social media land. Thanks for watching. Next week is Health Tips back at the Healthy Eats classroom with Elena and Inika, and you'll want to tune into that. You'll be seeing some promotions coming for that soon. Thanks so much for your time today, Melissa.
Thank you. I appreciate it, Renee.